Thank you very much, Madam Chair. Dr. Hogue, the public school system in Montgomery County, Maryland requires all students who may have been exposed to a student who tests positive for COVID-19 to quarantine for 10 days. But according to parents, a student who shows symptoms similar to those of COVID-19 at their school or in a classroom isn't being tested before the school district decides to send everyone who may have been exposed to that student home to quarantine. This policy resulted in nearly 2,000 students being quarantined in a week and entire grades of children being out of schools. The county recently reversed that policy once they rolled out a new rapid COVID-19 testing program. Should a testing strategy or program, including rapid tests, be in place at schools to prevent unnecessary quarantining?
Yeah, thanks for that question. That's a problem right now across the country, that children are being sent home when they've been exposed and quarantining, resulting in unnecessary educational losses and exacerbating the problems that we've been discussing. And in the Lancet, there was a very well done study out of the UK that looked at the Test to Stay program, where they tested children who were exposed 5 out of 7 days of a week, and if they tested negative, each morning, they were allowed to stay in school, and they didn't find any significant difference in terms of disease spread if they were quarantined or if they did that rapid testing protocol. And a number of districts across the United States have adopted that, and I would highly recommend doing that in school districts. I would highly recommend that the CDC recommend that program to avoid further learning losses and exacerbating the secondary effects from the pandemic on children.
And I think you touched on my next question as well, because I was going to go to a new study from the Lancet, a medical journal, that found case rates were not significantly higher at schools that allowed close contacts of infected students or staff members to remain in class with daily testing than those that required at-home quarantines. Have you looked at that study, and is that the same thing you were just trying to say?
That is absolutely the same study I was looking at,
Right.
I was discussing, yeah.
Yeah, that's what I thought. It sounded like it. There went my second question, but I appreciate that. What are the impacts of social isolation on our children from school closures? What are you seeing? We've heard about suicide, but what other impacts are you seeing?
Beyond suicide, it's screen time, it's increasing amounts of abuse at home, it's poor diet. The kids when they're at home, their parents are usually working, not inside of the house, and so it's been a concerning effect that kids are left to their own devices and not in PE or getting the same amount of physical activity, not going out to recess, and absolutely
Yes,
humans
ma'am.
are
Let me
social
focus in.
creatures, and so
Let me focus in on one of those.
yeah,
Do we
yeah,
have
absolutely.
do we have any good data yet on the rates of abuse and neglect that we've seen during the pandemic? Is it up? Do we have any hard data on that? I mean, the
Yeah,
supposition
so
is it's up.
the most recent study I saw actually looked at infants and found that the rates of going to the emergency room with abuse was increased, but I actually haven't seen a study yet in older children, and I don't know if anyone else could speak to that, but that's clearly a concern.
I see Dr. Beers nodding. That's one of the nice things about being in the room together. Dr. Beers, do you have some specific data on abuse and neglect of children in school age as a result of the pandemic?
Yeah, no, I would agree with Dr. Hogue that we're seeing some early data, and certainly anecdotally we are hearing, but it is a concern. We agree.
Yeah. And I'll go back to Dr. Hogue, but I'm just curious, what about remediation for students in the school? I mean, what we're seeing, at least in Virginia, and I think it's probably true across the nation, is that things didn't get taught that were supposed to be taught because they didn't have time. I mean, my kids were at varying degrees going 2 days a week, then going 4 days a week as we got later into the year, but still doing a lot of virtual work as well. What are we looking about in regard to remediation? I know we've gotten a tutor for our kids to try to help get them caught back up on what they were supposed to have learned during that full year of COVID shutdown or virtual learning.
I'm glad that you brought up the fact that you got a tutor, because this just points out the fact that because we have no national strategy for accelerated learning this year that it's the kids who are socioeconomically disadvantaged and don't have access to a tutor, and with more school closures that are going to fall further behind. So it's concerning that we don't have a consolidated national strategy for catching kids up, because as we've seen from the data, again, it's the kids who are socioeconomically disadvantaged that have fallen the farthest behind.
Yes, ma'am. So we need some remediation. I appreciate it, and I yield back.
I thank the gentleman.